to the people that they're in control of, the people that they're in charge of. That is the bottom line. So how do we mitigate that? Well, I mean, you can fight back in the workplace, unions can fight back and push for wage increases and so on and so forth, but you can also build up public services that mitigate income inequality, that transfer wealth and income to everyone more equitably, right? And so at the same time as we've seen the labor force restructuring that has geared economic growth to the upper classes only and no one else. And actually, by the way, they're the only two categories that have put less hours into the workforce now. Everyone else is actually putting more hours into the workforce. So more hours, because the ways that families have stabilized their incomes is to put more hours into the workforce. I look at Charlie, your dad, you know, you grew up, you had one dad who worked in a plant at a factory, and your mom worked at home, 5 kids, and you could own a house and have 5 children and live quite well on one income. That could never happen today, right? So now it's 2 people working, one, you know, cobbling together 3 jobs or working time and overtime in order to maintain your standard of living. But the upper classes are actually working less hours and taking all of the big salary increases. This is really significant because public services play a huge role in creating equality. And so this plan, this long-standing plan of privatizing everything they can, and austerity goes together. You empty the cupboard, then you say, oh my God, the cupboard's empty. We can't provide for everyone anymore. And that's what's happened over and over and over. So anyway, so budgets. So the Ford government came into office after his first election in 2018, and their plan was for the most radical cuts to provincial revenues, to the size of the provincial budget, which of course would result in service cuts. But like many years of elections, they promised more for less, not possible to do endlessly. And we ended up with major cuts. Hospitals, real dollar cuts, long-term care, like running at basically inflation or real dollar cuts. So 0 real increases or real dollar cuts. And then major restructuring. They passed legislation that allowed them to privatize anything sort of at whim. They passed legislation to restructure the whole healthcare system. This was leading into the pandemic. And then they made plans for public health and for EMS, for paramedic and ambulance services. And the plan for public health was to take what was then 35 local public health units, to merge and close them down to 10, right, across Ontario. And for EMS was to do the same. I think there's 22 or 24 ambulance dispatch centers, 22 across the province, and 59, between 54, it depends how you count them, 54 and 59 local EMS services. They wanted to merge those down to something like 10 to 20 or somewhere in the numbers varied over time, and privatize them. I mean, the whole thing came from a consultant's report that called for the privatization of them, and interestingly, the consultant himself had previously was the former owner of a for-profit ambulance company. So there you go. Anyway, so that was the plan. All of that obviously had to be put on hold, partly because municipalities fought back. I mean, some of them very courageously, very loudly. We fought back. Remember, we did mass rallies around Ontario on this, and they actually rolled back the cuts to public health. They cut public health dramatically leading into the pandemic. If you might recall, it took them a long time to reverse those cuts, but they rolled them back. And then, of course, the pandemic took over everything. Those plans have not gone away. They are still on the table. The government, even through the pandemic, has never rescinded their plans to restructure public health, to close down local public health units, to restructure and close down local EMS services. I very much fear that they'll come back probably this year, early in the new mandate of this government, and we're going to have to fight those cuts and privatization. So that's EMS and that's public health. Home care. Oh, sorry. Peter? We're going to have, yeah. Okay.
Just clarity, I don't know anyone that has an EMS that is not private already. Do we have public ones anymore?
Yeah, virtually all of them are public.
What municipality?
Like
I'm
they're
talking
municipal.
about the ambulance services, maybe that's not.
Ambulance, that is
Yeah.
ambulance, yeah. They're municipal
We've
and they're
never
public.
happened in our area, so I just. didn't-
You're in London, so Peter's
Yeah,
saying
it's
it's
private.
London's is privatized.
It's been always that way.
So when we have the discussion and people, like, I don't know if, I mean, most of them are public, they're not privatized. Yeah.
Thank you.
Okay. Okay, sorry, home care. In home care, they passed Bill 170, which is the, oh gosh, I forgot what it's got, like, connecting people to home and community care, or whatever, the act.
Community Care Act.
The new connecting people to community care or something like that. So they passed, sorry? They passed the new act for home care. And that act, really what it did was just gut the home care legislation. It took everything pretty much out. They took the Bill of Rights for, supposed Bill of Rights for home care clients. They took, all of the sort of guts of the home care bill out and said that they were going to put them into regulations. So regulations sit under a piece of legislation. Legislation is a law. It has to be passed by the elected legislatures. Regulations sit under a law. They're supposed to be the details, but not the meat of the law. And they are passed by the cabinet of the ruling party, right? So just the ministers of the Ford government. They don't have to go to the whole legislature, and they can be changed by the cabinet, so they're a lot easier to change. So it's not necessary. It's less democratic to put more things into regulations because it doesn't get debated in the legislature. It's not, the public record exists, but it's not scrutinized in the same way. And there's, very little opportunity for people to have an effect really on regulations. So the new plan for home care is to really hand the entire system over to the providers. It could be the HCCSSs, which have replaced the LINs, lots of acronyms, I'm sorry. Those are like the regional bodies that are supposed to govern. And so they could either provide the services or the provider companies, including what was the role of the LINs before, the case coordination, that kind of role, can also be handed over directly to the provider companies, and then the provider companies distribute out the home care system amongst themselves. They can contract and subcontract each other. So what they wanted to do really was wipe out, we always had problems with the LINs, right? They were not what we wanted. But they were publicly owned, publicly governed. They're answerable to the government. They were public. So now that whole public governance is going to be sort of over time eradicated, and the system parceled out by the provider companies themselves. Well, who has the majority of home care now? The for-profits. Overwhelming, almost 80% of the market share is controlled by the large for-profit chain companies in home care. Who's going to be placed to contract and subcontract out home care services, to take over care coordination and so on? Mostly the for-profits, right? It's not going to be one little local Aboriginal, home care provider in Thunder Bay. It's not, it's going to be a province-wide chain for-profit. So that's the plan for home care. It's about expanding the privatization of home care and dismantling public governance. That is also what's happened across the health system. And Ross will talk a little bit more about the OHCs, the Ontario Health.
Very healthy.
Ontario Health Teams, lots of, and so there, in dismantling the LINs, dismantle public governance of healthcare, and then hand it over to the provider companies to organize amongst themselves, which is what the OHTs are, agnostic as to whether those companies are for-profit or not-for-profit or public, right? And so obviously, then you can have your for-profit long-term care companies deciding what proportion of services and so on will be provided by long-term care. So the profitable stuff, the short-stay convalescent care beds, etc., from your local hospital can be privatized then into long-term care. And Ross will talk more about what that means. So long-term care. Here we are. Really, after the military reports came out in which they exposed horrific, really truly hair-raising conditions in long-term care homes, in which people were dying alone, they were dying in squalor, dirty, smelly, disgusting conditions with far too few staff to provide for them, bug infestations, bare mattresses, no clean linens, not enough food, medication that had expired years before and was still being distributed to residents. I mean, absolutely horrific conditions. And I just like to say, this is not the first time these conditions have been exposed. I started in 2000 at the Health Coalition as the executive director. I was on the board for 5 years before. And in the late 1990s, the Paris government had done away with the minimum care standard. That the NDP had brought it in, that they were in 1994, and at the time it was 2.25 hours per resident per day, and the residents would like walk to the front door and check themselves in. You know, that's how well they work. They closed, 19,000 hospital beds, half of the chronic care, the public's continuing care hospital beds, offloaded all those patients to long-term